positive vibes and good energy. But we need support. We need to support to keep doing this.
Yeah, you've got it psychologically and hopefully financially.
All right. So our next speaker and final speaker today is Dr. Annika Linde, Associate Professor at Western University of Health Sciences in Pomona, California, and co-founder of the True One Medicine Initiative. She's a clinician scientist specialized in cardiology, nutrition, and public health. Dr. Linde's work is rooted in evolutionary and lifestyle medicine. She completed her veterinary degree and cardiology training at the University of Copenhagen and the University of Pennsylvania, followed by a PhD in cardiovascular physiology from Kansas State University and an MPH from UC Berkeley. So her diverse experience includes certificates in plant-based nutrition and sustainability from Cornell. Dr. Linde's research spans clinical cardiology and species spanning medicine, with current projects focused on the planetary and health implications of plant-based nutrition. She's a dedicated educator, committed to fostering innovation through interprofessional practice and research. And she will discuss today the true cost of industrial farm animal production and widen the lens of today's plant-centric nutrition discussion to consider public health, ethics, and economics in reference to the existing plant or existing food system. And she will discuss belief systems that drive consumption of animal products and the extent of externalized costs from industrial farm animal production. So, Dr. Linde, please take it away.
Thank you so much. And thank you so much for this invitation. First of all, let me just know, can you see the screen okay? Do you see the title slide okay?
Yeah.
Yeah, you see it fine. Okay, great. So I don't think I'm going to spend a terrible amount of time with that lovely introduction. And I know that some are logging in from quite different time zones, and I know that we're sort of getting to the end of the day. So what I'm going to try and cover is, as you probably could get a feel for, is sort of rather, I guess, ambitious in the time we have available. And I know many come sort of from the human health space, but I nevertheless wanted to try to have a little bit of a discussion to wrap up this summit today. And as you probably know already, every 34 seconds or so, someone is dying from cardiovascular disease in this country. And this is impacting families, it's impacting everyone. What you're seeing on the pictures is me in Denmark. Back in the 70s, I actually lost my father to a fatal heart attack. And like many, we know that that impacts families, it impacts the course of one's life in many ways. So these are not how things have to be. These are all connected. We know so much. We have so much information at this point. So what I am trying to do with this presentation, as Bev was including in the introduction already, is to try to tie these things together to just give a little bit of sort of an overview of, if we are thinking what we're referring to with our True One Medicine initiative, and really moving between these sort of nomenclatures, and that emphasize planetary health on this slide, but really talk a little bit about what are public health implications, the ethics of this, the economics. So that's sort of the idea with this presentation. Bev also covered my journey already, and this is the slide I typically utilize to do that. So I won't spend a lot of time on this, other than to hopefully have it reflect that my journey has included both the basic / foundational sciences, as well as the clinical sciences, and what we are realistically referring to as health system sciences. So really those different pillars of education. And as indicated in the lower left corner here with the picture from UC Berkeley, really that public health framework, and also ongoing thinking about how does this all tie in between public health, really medicine, but also what's the economics of this, and really thinking about how can we speak to a number of different stakeholders, and everyone who really are impacted by this ongoing crisis. Now, One Health, as we're seeing on the left-hand side, historically had most of really an infectious disease sort of spillover implications to it. And this was this very classical sort of Venn diagram between that intersection, thinking human health, animal health, environmental health. And more recent years, we have increasingly started to talk about planetary health, to really understand how each and every one of us, we are living in a sphere that is part of greater communities, the public health implications. We're living on this shared space, the planet. We know that there are these One Health implications, but really how the stewardship of the natural resources are just intrinsic for everyone to be able to maintain health. Health is a human right. Health is a right for other non-human animal species as well, and really being mindful that we're really stewards. So trying to move away from this sort of extraction. And I really, really appreciate all the photographs from Joel Sartori, and that's really from National Geographic, and that's what's included here. And being mindful of everything we're doing is just also connected with this tremendous loss of biodiversity. So this is a summit, of course, where we're talking specifically on companion dogs. And I have had three wonderful colleagues, friends, providing presentations to you this morning and afternoon already. And what we just tend sometimes to keep track of is also really all the amazing species that we're sharing this planet with. So what we typically have people thinking is sort of this very almost childhood memory of, what about farm animals? And for many people still probably not in this space, because everyone here has very good understandings of what really is truly going on. This is very, very far from the truth, right, of how these farm animals actually exist. Numbers, of course, are, as you probably well know, are just so extreme. And for most of these animals, they spend their entire short existence in factory farming or concentrated animal feeding operations. So these are all synonymous, basically. So industrial, interchangeably, you'll hear food animal, farm animal production settings. So we're talking in this really about, well, what are the implications if we're thinking about this in that global health context? This slide is just outlining some of these reports where the conversation really started. So there were United Nations reports that came out, and this is 20 years ago now where this conversation started. And I have included the source and then just at the front cover, and then sort of the numbers that these reports came up with and what were the experts really behind this. And as you can notice, between even UN agencies, so from the FAO, these were livestock science experts. With the World Bank Group, these were environmental science experts. And as we know at this point, there's a lot of literature, data, publications, report out there. And of course, you can see anywhere ranging from this around 15% of the global livestock industry, how much does it actually contribute to this anthropogenic, the extreme amount really of greenhouse gas emissions. And we can see these numbers vary, and you know that there have been publications after this as well, of course. But the point remains, these are substantial numbers. And we know that in the climate change context, animal agriculture has a tremendous impact and adverse impact. I know that there are questions coming into the chat and I'm seeing them sort of popping up, but I think what we'll do is we'll go through the slide deck and then at the end we'll sort of have a conversation about the content just in the interest of time. This is a recent slide that was included. This is from Dr. Sieg Hausvater, who's an experienced climate scientist, energy systems analyst, as indicated on the slide. And what he did here, I think, is actually quite remarkable. So it's this scale, and it's trying to visualize the total amount of anthropogenic CO2 emissions. So since the Industrial Revolution, and this is sort of trying to illustrate really how massive this is if you're looking in the amount of gigatons. So just what humans have emitted of greenhouse gases since the start of that industrial revolution, and then try to compare that, if you put it on a sort of hypothetical scale, with all the living biomass, the dry weight of that, and then all the human-made mass, really the combined weight of that throughout human history. So just really, I think what he did here was just quite remarkable in really trying to illustrate how extreme this really is in emissions levels. And this, I'm sure you're familiar with as well. More than 10 years ago now, the Cowspiracy, how that really created much, much larger scale awareness with regard to the One Health implications of industrial farm animal production. And this was really what inspired me when I did my public health work, to work with the late professor of global health and one of the co-recipients for the 2007 Nobel Peace Prize with Al Gore, for his work on the Intergovernmental Panel on Climate Change. And we talked about, really, for the capstone that I did, I actually went in and I looked at everything that was sort of presented at that time, to sort of look at the scientific rigor, if you want, and really just, it was really eye-opening in so many ways to see the livestock industry. And I think many people at this point have seen this, and of course related and subsequent documentaries as well from various groups. But just the amount of impact on the industry when it comes to percentage from really global greenhouse gas emissions, climate change, water use, driving deforestation. We talked very briefly species extension, amount of waste production coming out, right? Land use being increasingly just extreme as populations are growing. And then, as you know, there's also a documentary that came out subsequently focusing on the world ocean. So this is really what I focused on for the public health for this capstone that I did. And then one of the things that is really extraordinary is seeing the amount of data coming out from the IPCC 2018. Of course, they had their 30th anniversary. And we have the most recent of the synthesis reports and summaries for policymakers. So the point with the next slide is not to go through details, but for those who are unfamiliar with how the Intergovernmental Panel on Climate Change works, just to show that the amount of evidence since this really started in these 30 plus years, 35 plus years now, is really an incredibly rigorous process. So there's really no doubt of, how solid the evidence, of course, is. We are undergoing, again, time with really accelerated anthropogenic climate change. And as we're seeing, this is the sum of the evidence at this point. We also know that across the sectors, this is from, again, the EPA, but we know numbers vary across different reports. But the point here is across economic sectors, we just keep seeing, across most sectors, we keep seeing increases in emission levels. So CO2 equivalent, this is just showing since the 90s, of course. We know the parties came together, countries came together, the Paris Agreement, even since 2015, is just emissions that just kept going up and up and up. And some industries, of course, are more difficult to abate, but for sure, there's just such tremendous potential, as we know, when it comes to really the agricultural sector. This is the emission gap reports that are put out every year as well from the UN Environment Program. There's just 2 points here. So the excerpt that is down below is showing that we are up again over this time frame. We are up close to hitting almost 60 gigatons now. And this is since you'll hear like 40 to 60 almost in this period of time. So really just extreme, just keep increasing, putting more emissions out there. The excerpt on the right-hand side is showing just in that preceding year that went into the report from 23 to 2024. It's showing across the largest emitters and showing how much in that annual increase, how much did each of the largest emitter and the rest of the world, how much did they contribute. The only that actually managed to decrease was the European Union. And again, we're seeing the land use changes. The food sector was a significant contributor. So if we also try to look back in time, I think it's worthwhile to sort of recall what is it that how far back do we go, if we will, in sort of trying to put all these pieces together. And this is the picture of Norway's first female prime minister, Dr. Gro Harlem Brundtland, trained as a physician, public health degree from Harvard as well. And this is where she chaired the report, Our Common Future. And this is back from the 80s. But this really important part, just the quote here, right, that humanity has the ability to ensure that development is sustainable. And importantly, to make sure that it meets both the needs of the present, but it should not be compromising the ability of future generations to also meet their needs. And from this is what we're seeing, these 17 sustainable development goals from the UN that it's important to sort of keep referring back to. And we can very quickly see the climate action that, of course, hope had been that much more progress had been made if we're looking back to the 80s and see where we're at today. So a lot of talk, lots of reports, lots of data, lots of science, but of course, not anywhere near the progress that I'm sure everyone had hoped for at that time. We also see, and we'll sort of, we won't go through, of course, every single one. Partnership is an important notion as well, that we really need to be able to talk across sectors. And that's also why we added this talk at the end of the presentation today. But we see good health, well-being as well. We see sort of the idea that, no poverty, zero hunger, to protect life both on land and water, to be able to have economic growth, which indeed is a possible. This is not this sort of having to pick and choose. All of these things are indeed possible under these. The Lancet has put out several reports, and the global syndemic is one of those things that when we really think about it, the intersection between talking about what is effectively malnutrition, both on the side of the obesity epidemic we're seeing, but also the fact that so many people worldwide still suffer from hunger, undernutrition, and then, of course, everyone worldwide dealing with the growing impact of accelerated climate change. So really having this triple threat, but understanding how all of these things are interconnected is just increasingly important. And of course, this requires a multi-pronged approach, right? To both have the policies change, being the public engaged, having crosstalk across different sectors, industries, and making sure that there's actually willingness and everyone sort of working to really address this in a meaningful way. We've seen, and this is sort of pointing back to what was mentioned already back in the 80s, right? That it needs to be also viable for future generations. It's really just very saddening and just striking how much damage has been done and the lack of climate action. And of course, younger generations, we see examples from the Nordics, from First Nations, many more really being out and saying, hey, this is our future, this is serious. And again, other species, importantly, right? Thinking about the biodiversity, everything that is sort of being lost in the continuous race for growth and trying to achieve more and more without thinking about the consequences. On the public health side, when we try to reimagine really One Health, I mentioned at the beginning, thinking about One Health as that intersection is it's all good and fine, but really what we're dealing with increasingly is the concept of syndemic. So having several concurrent epidemics ongoing and really thinking about how you have both infections, you have non-communicable diseases, you have mental health issues, you have what are the toxic exposures, environmental exposures. You have so many things, and all of these things also involving so many inequities and growing inequities as well. And that's why we are really increasingly starting to think about this as syndemics, that we have many more things going on than just simply infectious disease spillover, as we saw with this very recent pandemic. So I put up this slide just to say, well, some have mentioned really, right, that in very real ways, extreme weather events, we're seeing wildfires, we're seeing, of course, people's residence burning. We're seeing so much consequences, adverse consequences, but also important to think about what are sort of all these ripple effects. The other thing, in addition to the disease, the changes, the biodiversity loss, spillover events, non-communicable diseases, is also the impending, what can realistically be sort of the end of modern medicine as we know it, with growing antimicrobial resistance. And we have an area of our research tying into that. And that whole field is really quite frightening. We don't have time today to go into this. But the notion of thinking that we are increasingly facing a lack of functional antibiotics and knowing that 80% or so of antibiotic usage actually goes into the veterinary side, not the human medical side, and so much of that going into, again, factory farming is a real and growing concern and issue. So there's really a lot of things we need to tie together. When we're thinking about determinants of health, I like sort of this is based on a New England Journal of Medicine, so leading journal in human medicine, but it was several years ago, almost 20 years ago. But I really quite like just the simple notion of thinking about so much of determinants of health is actually not healthcare. And this was something until I really got to the public health field that I didn't necessarily think that much about. We sort of always think about, well, you have good healthcare, you're good to go. There's so much of it, of course, that has to do with what environments do you live in, what's behavioral patterns, environmental exposures. Yes, there's part of it that's genetic predisposition as well, but doesn't necessarily say that it's set in stone. There's so many things when we're really thinking about it that is everything outside of healthcare. And the graphic on the left is really about how, in many ways, both the human nutrition science, medicine as well, it has sort of this reductionism to it, right? Let's just increasingly focus on greater and greater details. And we're losing track of that bigger picture. And what the talk is hoping to do is really tie these things together and think about this bigger picture. Public health, we also talk a lot about. This was Dean Ornish has used sort of this analogy as well in his talks about overflowing sink concept, but it is very much that classical primary prevention for public health, thinking about, do we want to primarily work upstream or do we want to work downstream? Now, if you have an overflowing sink in a most basic way, you can choose to keep mopping up the floor, or you could choose to turn off the faucet. You could address problems in different ways. Same thing when it comes to the chronic disease, really epidemics, and what we're seeing realistically are more adequately, appropriately described as syndemic. Really what we want to do is primary prevention. The graphic on the right, the table here is from JAVMA some years ago, but point is healthcare spending in the US, if we're looking at spending and if we're looking at number of US deaths and we're looking at risk factors and again, number of deaths, the vast majority we're looking has to do with dietary factors. So fact remains, as we talked about at the very beginning, most of the morbidity, mortality is preventable. It's associated with dietary risks. And US healthcare spending just keeps going up year by year by year. And most of the spending, realistically, if you're looking at data from American College of Lifestyle Medicine, other sources as well, the vast majority of the chunk of that spending has to do with these chronic, largely preventable, non-communicable diseases. Of course, with the pandemic, a lot of deaths as well related to that. But if you're looking over time, this is the pattern you're seeing. As I'm sure this audience is well aware of, you have lifestyle medicine physicians that have shown and studies also with the China study that I'll mention briefly, But the fact that the leading killers in this part of the world, if you're actually looking at cultures, traditionally plant-based cultures worldwide, something that is the leading killer in this part of the world, the Western typical standard diet, we know that atherosclerosis is essentially non-existent. And this is true if you're looking globally. And this reference is from Dr. Esselstyn's paper. And we also know the pioneers, and this is just showing a few. I mentioned Dr. Ornish, mentioned Dr. Esselstyn, Dr. Kim Williams, past president of the American College of Cardiology as well. He said, sort of tongue in cheek, there's two kinds of cardiologists: there's the vegans and those who haven't actually read the data. He did say at a subsequent talk, well, there's actually three types, because there's also those who've read the data that just haven't acted on it yet. So the point is, a few years back, Dr. Ornish and Anne Ornish came together, put the book out here, but really to say that there's all these lifestyle changes, right, that can prevent reverse. So it's not like one specific type of diet for every, that you can actually use these lifestyle medicine principles. And this famous paper that you probably have seen as well, just showing reversal of coronary artery disease. So purely plant-based nutrition intervention. And I'm sure that this is not the first time you have heard this, but you can literally have arteries clearing up with nutritional intervention. This was news to me when I first started reading this literature, even though on the veterinary medical side, reading comparatively, I thought I had come across, enough to have a good understanding of the cardiology literature. So a lot of times we hear people like, well, there's a lot of sort of differences of opinions. I think it's great. We have Dr. David Katz that started the True Health Initiative, and we have the American College of Lifestyle Medicine. The graphic has since been updated, but the notion of this is sort of really proven principles, time honored, utilizing lifestyle as medicine, and of course these main pillars, and the plant-based eating being one of those main pillars. This is what I mentioned early on. This was in the introduction as well. This is sort of really the start of my path, the work from the China study and Dr. Campbell, and the certificate course, both in plant-based nutrition, also food and sustainability, to really understand that there's just a wealth of evidence favoring. This is from a few years back as well, just really showing that many, of course, are concerned, can people actually thrive? Short answer, yes, indeed. We know there's plenty of literature, position statements, other references in addition to this, athletes as well. We know that from documentaries. We know there's a lot of literature out there. And some have mentioned that much of what we're sort of facing now is really about, we can sort of make to some extent some comparison, right? To say, well, the obesity epidemic is actually impacting the physician workforce as well. And there's really a tremendous amount of lack of nutrition, proper human nutrition education in medical school curricula. This is really true for health profession curricula sort of across the board, with very few exceptions. Most recently, there's been much more focus, and there's much more of a push right now, actually, as of the last, let's say, maybe year or so, to get more nutrition education into medical school curricula. So this is not going to change overnight for sure. But some have noted that, if you didn't know, there was a time when doctors actually endorsed the tobacco industry. And of course, as we know, there was, some similarities between the tobacco industry. There were also attempts with like the merchants of doubt to, cast doubt in the earlier days over the existence even and, the reality of climate change. But we know better now, and the hope is that, of course, we are going to go in the same direction. We'll transition and talk about some of the ethical implications. And of course, I acknowledge that this is a lot of material to try to have in a single talk, but I also wanted to point out that we are seeing increasingly on the side of medical journals and even the specialty journals that this is actually not something that we even should be discussing whether this is real. We shouldn't be discussing anymore whether this is actually an okay status quo. This is time to change. the American College or American Journal of Cardiology. So really thinking about the American College of Cardiology, thinking about the journals, thinking about what can you do from a human health perspective, but a group also of authors coming together a few years back to actually say, well, nutrition equity is a moral imperative. We know that nutritionally, ethically, the standard Western diet is really, really problematic. We know that there is effectively legalized cruelty to animals in this factory farming system. So the point is that at this stage, the physician workforce, the medical profession also play a role. All health providers actually play a role. This is contributing to really medical and moral harm in humans on both individual and public health scale. So going from that, excuse me, going from that, if you have come across also the documentaries, the work, I wanted to just mention these concepts on a couple of slides as well. More than 10 years ago, and I still mention this because I actually think Mark DeRice did a really great job with Speciesism, the movie. Now, the term, if you're familiar already with speciesism, but the notion of assigning value based on species membership and thinking about how does that actually tie into other violent ideologies of assigning value, if you will. So in this case, speciesism based on species membership. So coined originally back in the 70s, of course, as the pictures here, back to the sort of acknowledging the original when the term was coined. So British psychologist Richard Schneider, writer, and Peter Singer on the right hand side. So back from the 70s, and then on the right hand side, Melanie Joyce. More recent work. So this is just a link to just, I think, a very nice and concise, just sort of overview of what is it she means by coining the term carnism. So she has defined it really as this invisible belief system, or ideology that really conditioned people to eat certain animals, right? And the sort of the framework upon which this is based, sort of the denial, the justification, the cognitive distortions, really is a couple of screenshots also for that same. I included the link on the previous one, but really the need for having that greater awareness of what is it that actually is going on in these industries, and why is it that people are actually behaving the way that they are. So the conditioning to be eating some animals, and then really the notion of having these invisible victims, the animals that have a lot of capacity to feel and, of course, have social relationships, lives in social context, and really the fact that in order for people to actually have this institutionalized and internalized notion of that it's okay to be eating that there is sort of that requirement to having the what is considered normal, natural, necessary, that justification, and really the denial, being able to have the factory farmings where no one really can see it unless you're part of course, those of us who have been seeing these things on the inside, and very much the cognitive distortion. So really being able to somehow realize that something is going on, but still not actually acting upon it. And in addition to this, sort of the taste preferences and the food addictions as well that people are really realistically subject to as well. The other ethics and the other things that really should be mentioned here. This is Dr. Joan Casey that I crossed paths with through my work at UC Berkeley, Public Health, and she's one example of the work that she and collaborators have been doing, but really to understand also that factory farming also has significant implications when it comes to community health, adverse outcomes for communities. This has to do with what is all the waste that is put out into the environment. How does this actually impact air quality, water quality? And these are typically lower socioeconomic communities. So you don't see factory farms, of course, in very wealthy areas. So there's a tremendous amount of social injustice as well to the animals within these systems, and to the communities as well who are living close to this and exposed to those things. And I'm sure if you've seen also documentaries about people living in these communities being at risk. The other notion is, what about if we're talking in addition to all the harm done to the animals? And the little schematic down here is that notion of people we have talked about today, the companion animal side, but that somehow there can be that sort of callous transition to saying, on one hand, petting a companion animal and turning around and killing. There's also the occupational health implications, and it's not easy to find studies because, of course, people who are working in slaughterhouses are not eager to speak up. But it's important to notice that there are significant both physical and mental health implications of people who are effectively working, killing for a living. So this is impacting the animals, it's impacting individuals working in these industries. And the notion of moral injury was something that originally was a term in reference to veterans returning from war, having been in combat zones. We are also seeing now publications, literature coming out, also particularly after the pandemic, related to the healthcare profession. So the notion of moral injury, when a person is committing or failing to prevent or witness an act that is direct opposition to what is really their moral belief system. And this, of course, is also true if you're thinking about a veterinary medical context, those who are in these systems, those who are working in these systems. So there's a number of different implications to consider. We'll move on to talk some about the economics of all of this. This is a slide that is trying to relate both some of the financial sort of thinking about the economics of this and how it really doesn't add up, and some of the legal implications of thinking about this whole industrial complex. In the center, I've included the front page of the 2013 book, Meatonomics, by lawyer and also Berkeley alumni, David Robinson Simon. What he did here was, to the best of the ability, as you can do with available data, trying to come up with what are all the externalities, even if you don't consume these products. If you're thinking about subsidies, if you're thinking about what is being imposed upon you. And if you try to take every single thing of what goes into this industry, if you haven't read the book, I would recommend it. It's definitely, of course, some years ago, you can say, well, numbers, you would be looking at 2026, you'd have to sort of think about those numbers changing over time. But the concept of really thinking about, if you're thinking about externalities, what is it that goes into the system? How much does it actually cost everyone, whether they're actually purchasing these or not purchasing these products? The other thing I want to note is, again, I mentioned on another slide, we're upwards of $5 trillion now annually spending on US healthcare, much of that preventable diseases. And the number here should also be updated. But the point being, compared to other, if you're looking at economics, other OECD countries, the US is spending about twice as much as other countries on healthcare spending. And what is quite sad is it actually is not getting the outcomes. Even if you're just looking at life expectancy and you're looking at the trajectory, the sad reality is a lot of money is going into the system for healthcare, but unfortunately the outcomes are not actually proportional. On the right-hand side, I have just the first page of a paper, and this is just to show that there's also legal implications in the sense of how animal rights activists, people who have tried to shed light on all these issues, have been labeled terrorists. And this you have to sort of find in law journals. And Will Potter, I crossed paths with several years ago at one of the conferences that the Cowspiracy, when they did their meetings, and Of course, he has been doing a lot of important work in the field of investigative journalism and really exposing what is going on in the context of the factory farming system. So sadly enough, when you're sort of thinking about this and you're thinking, people like to think about, well, if you want economic growth, it's like it comes at a cost. But the reality is climate change, in addition to what we have seen, public health, ethical implication, all of the things that really go into it, it is also really, really bad for the economy. And there's, I think, more discussions about now. It is not this sort of false dichotomy of, you see this scale and saying, oh, do you want a healthy planet or do you want a healthy economy? Actually, it's quite the opposite way around. So when we're looking at this, I included these graphics. It's from the Boston Consulting Group, and it's 2025. What these two figures are basically showing is if you try to project what are the costs of climate inaction. So on the degree of scenario where there's really temperatures, if you're looking at compared to just pre-industrial time, you're looking at over time temperature keep increasing. Of course, all the implications of that, looking at reductions in gross domestic product and really taking that sort of as that sort of growth indicator. It is quite substantial. So here are just some numbers from these graphics that if you have some of the worst trajectories in increasing global warming, it could be something like a third of cumulative GDP by the end of the century. If we're looking at the right-hand side, what is the cost projected of inaction? Here we see between maybe 11-27% of what is the total economic output. And again, the net cost of inaction, if we're looking at some of the higher scenarios, if you will, what would the economic damages be? And this is as cumulative GDP in percentage. But the point is, if you're actually looking at mitigation investments, they remain relatively small compared to the cost of inaction. It's very, very substantial. And then there are going to be, again, percentage of cumulative GDP. There's going to be some that are going to be unavoidable. But the point is, even if you're looking at the economics, it makes good sense. It makes good sense, of course, from the health perspective, from the ethics, and also from the economics. This is from the same report. And the key take-home message from this top figure here is the issue remains that most of the investments that are needed in climate action, they need to happen quite soon, before 2050. But most of the benefits are going to be realized after. So the point is, if we go back to the Sustainable Development Goals, to really think about, we need to plan for what are future generations to also be able to enjoy what we have been able to enjoy. So this is a quite important point. The other important point, and from the same report, the Boston Consulting Group, is you will see impact across the world. These are estimated GDP losses. So how bad the economy is going to be impacted. For the US, estimated in a decrease impact of around 10%. But if we're seeing the global south, as it often goes, greater than 15%. So worst of the impact are going to be the most vulnerable part. And this is where the social injustices, that conversation come back in. And then they're really outlining down here in the report is that we need to really have people understand that the cost of inaction is really, really significant. And I included one example down here because where we started out was, again, thinking about, well, I studied in Denmark. This is where I grew up. And I'm actually quite encouraged to see, I visited in March, and now I visited Copenhagen as part of a Berkeley course on sustainable capitalism, thinking about how can you ensure still being mindful of sustainable development goals, being mindful of all these things, and still ensure that there's going to be economic growth. Denmark actually, the government has in 2023, there's actually a national level action plan. And the point here is go back to that Sustainable Development Goal 17, really being mindful of partnerships. This is multi-pronged. It needs to be across different stakeholders. It needs to be across different industries, government, individuals, science, and so forth. This is quite extraordinary in the sense of there's still, of course, way to go. Point is, this has been a country that was very, very heavy on animal agriculture. So the last part is about solutions. So I think it's not a surprise, really, if we're thinking about the agricultural sector. Factory farming is not sustainable. It's unfortunately a very, very cruel system. And those of us who've seen it on the inside have witnessed that. The shift definitely need to be towards what are sustainable, more ethical food systems. The energy sector, it's sort of been said, well, electrify everything. The notion of shifting from fossil fuels to renewable energy. Some sectors are more difficult to abate than others. The point, of course, also remain, it needs to be done in an equitable way if you're thinking globally. But what can be electrified for sure, this is not going to be enough, which is why the agricultural sector, the food system, is so critical. And the time scale, of course, is of importance. I mentioned one medical journal before. This is one of the realistically the top, the New England Journal of Medicine, and this is back, you can see, 2019. But really, to the notion that climate change is a health emergency, that again, this is speaking to physicians, but a special responsibility to actually work to curtail these greenhouse gas emissions. It's essential to the healing mission. So that's really an important message. You recall that you and the World Bank group from back now 20 years ago, Jeff Anhang and Robert Goodland at the time, the past Robert Goodland and Jeff Anham. I spoke to Jeff Anham when I did my MPH, and this is a chapter he did in a book. And this is basically saying, well, a pragmatic solution. And the fact remains, and this is the quote, replacing animal-based foods with better alternatives is going to be the only pragmatic way to stop climate change as quickly as it's needed. And of course, this is several years down. And I asked him at the time, would you still sort of come up probably with those numbers? And he said, yeah. And if anything, those numbers were actually on the more conservative side. So we have seen also reports from the Lancet Commission's 2019 notion of diets for sure being just linked to human health, environmental sustainability. So it's really at this point without doubt. Very recently, also, we see more of a focus. We have collaborated with the PCIM Physicians Committee, nonprofit for responsible medicine, and they also now have specifically one part of their site dedicated to planetary health, thinking about the planetary diet, linking back to the Lancet Commission. Of course, their focus has been very much clinical research, outreach, medical education, plant-based, shifting to human health study, getting animals out of lab, working with policymakers. But you see this now also as an emphasis area. The Good Food Institute, if you're already familiar with that. So I included just a couple of schematics. If you haven't seen it, there's a book out, new book. There's also a recent TED Talk by president of the Good Food Institute, Bruce Friedrich. I would recommend the book. The programmatic priorities for this think tank is the three sort of areas here. So what they're focusing on is alternative proteins. So one of the point is, despite all the advocacy that has happened over many decades, realistically 5 decades or so, the global demand for meat just keeps going up. So we know the world population is increasing as well. So what the Good Food Institute is doing, and this is a global network, different organizations. So really working to make the global food system better, both for the planet, for people, for animals, for everyone. And the focus here, plant-based culture, and also fermentation. So really working with different stakeholders and say, well, if people keep eating these products, there needs to be better alternatives. There needs to be parity when it comes to price with taste. But this is something that they have spent quite a bit of course, effort into. The different industry reports as well, and all of this are available on the website. There are other, as I said, when it comes to climate change, there are going to be some sectors that are difficult to abate, something like aviation, and there's a Swiss company, others where they're looking at actually eventually removing. This is going to be, needless to say, still on a very small scale, but there's both nature-based, technology-based, when it comes to saying, well, those damages that have already been done, fast forward, all hands on deck, switching, making both the agricultural sector, the energy sector. There's still going to be some that are hard to abate. There's some of these technologies, and this Swiss company, Climeworks, is one of them, working on those technology. So again, multiple things needs to happen. I think what is great to see is we have examples also across universities. If you're familiar with this already, these are just some examples, but plant-based universities are student-led, so different student groups across different campuses. We were contacted by one graduate student in physics, actually at Caltech in Pasadena, a couple of years back as well, that is studying this. I visited when I went to Copenhagen. I visited Lund University. Really great to see. They're ranked 1 for sustainability. They have plant-based by default. You don't even have to ask for a vegan meal, so that's quite great. These are some examples and movement that really are spreading university-led. UC Berkeley, there's the Plant Futures Initiative that I am getting involved with as of more recently. You could maybe recognize Miyoki down here from Miyoki, that is co-teaching across the campus basically, and of course outside of UC system as well. So definitely things happening. At Western U, this is a busy slide, and I know we are almost at 2:30 now. So just here as we're wrapping up, I wanted to just mention what is our thought process and where we're going from here. And I'm sure Dr. Melgarejo has talked about this as well. So we set up this in 2021. Dr. Melgarejo and I really founded this True One Medicine. We call it the Tommy. We founded it as an initiative that is intended to be basically interprofessional, interdisciplinary. So we acknowledge a lot of inspiration from different colleagues and different sites. I mentioned the PCIM already. I mentioned the True Health Initiative, Ubiquity as well, Dr. Madison Horvich, UCLA, Harvard, and many others as well. But really the notion of working collaboratively and lending inspiration from also non-experimental, ethical, clinical translational research, inspired by these evidence-based lifestyle medicine principles, as I mentioned, and the naturally occurring disease processes, how that can inform, inspire, which is also the notion of ubiquity. Also importantly, inspired by First Nations, the idea of really being stewards and thinking of natural resources, being stewards. So being respectful and mindful, also thinking of what are these practices within indigenous cultures and really the inherent respect for all living species. So these are some of the ideas that have gone into this, and we are working now on actually establishing an institute at Western University of Health Sciences. So this is an application, Western U Evolutionary Lifestyle Medicine Institute, and we're still waiting sort of for use a formal launch and actual approval, but this is going through at the university level. So we'll keep everyone posted. Acknowledgements, there's a lot of people to acknowledge. I have included sort of the main university affiliations and where I've lend inspiration from. Of course, I mentioned Berkeley several times, both the School of Public Health and Haas as well. I mentioned a recent trip to Copenhagen, going to Denmark to Sweden, really what can be sort of used of inspiration between the Nordics, California, where we're based, responsible business, how this ties into healthcare, the collaboration with Ubiquity as well. This is UCLA, David Jaffin School of Medicine, and also Harvard Medical School, the collaboration with Dr. Madison Horvich, Dr. Bernard's work, his entire team, the PCIM, and gratitude to so many other collaborators and people we have worked with, cross path with over the years. So I'm going to wrap up here. We are right at 2:30. And this is a quote from Joel Sartori. I showed you some of these beautiful pictures that he has taken on contact of National Geography. And really the hope is, as he said, that we look other creatures in the eye and be inspired to care while there's still time. And this is one of the images that he did for this photo arc to document all species and really encourage people to care about other species and being mindful of what is at risk and the amazing biodiversity. So I thank everyone for listening, and I'll stop here.
All right.
Thank you so much, Dr. Linde, for such a clear discussion about your journey as a clinician scientist. It was most fascinating. And now, as you were highlighting, we can continue Q&A. We can open it up to all questions.
Yes, and we'll bring Dr. Malgarejo back.
Right.
And
I think
Yeah, I think what I think he did is he did a very quick bio break, so he'll be right back.
okay, so we will once he's back, and on camera we'll spotlight him. But meanwhile,
we have a few questions.
I'm looking through. Yeah, I'm looking through. I saw that there were 11 new entries here, so I'm trying to find like what was the first one. So let's see, because I'm sure there's going to be a variety sort of between what Dr. Melgarejo covered and what I covered. So let's see. Yeah, so I think some of it is okay. So I'm here at thank you, Dr. Melgarejo. So I think, yeah, so Deb said, Dr. Sailesh Rao, climate healer, great source of vegan information. Yeah, for sure. And I know Wendy McPherson said climate healers, Dr. Sailesh Rao, and for those who I'm sure probably most know him, but system scientist, really, and the group, of course, he has a PhD from Stanford, has worked in really thinking about how do you sort of, if you really take all the numbers, put it together, that's what goes into their position paper. And I know Wendy's saying that there's a keynote as well, and lots of material signing up there. So let's see. Deb is asking, isn't the overcrowding of captive animals and subsequent stress, etc., on animals' immune system a major source of transmission of disease across species? So for sure, when you have factory farming, so these are animals that are forcefully put in these concentrated animal feeding operations. And most people in the public, of course, they don't see these individuals. So they live their relatively short lives in quite miserable conditions is the reality. And that's why I included that picture to say a lot of people are thinking, oh, we have these, farm animals, and sort of thinking about before things became what they are today, what we're seeing, where you had small family farms. The reality is you have a system that has both destroyed the small farms and have destroyed livelihoods for farmers. And now you have these massive agribusinesses. And if you're looking at the production, it's controlled by relatively few players. And you have a lot of damage done, of course, in the horrible conditions to these animals. So the short answer is yes, you live in highly stressful conditions. That for sure is going to impair your immune system. And then, of course, if you have spillover events, you have individuals with immune systems that are impaired from stress and any kind of transmission. Our colleague has worked with wildlife species as well, transmission events, spillover events. So you really, really have vicious cycles in so many ways. I see Dr. Melgarejo is back. Would you comment on anything on the question of stress, immunity, transmission of diseases, Dr. Melgarejo?
Just very quickly, it's as a mammalian species, the cortisol plays a major role in cows, in dogs, in cats, in humans. So it is obvious that there's I think it's a shipping disease, or I don't know. I'm not very familiar with the farm animals, but when they transport cows from one place to another, it is obvious that these animals, the shipping fever. Thank you. These animals are going to get sick, so they are waiting for them with tons of antibiotics that actually promotes antimicrobial resistance. And these poor animals can be transported for hundreds of miles and with no water, all crowded. It's the stress that is produced is horrible. We know that.
Yeah, the really, as Dr. Melgarejo said, and we have a separate sort of area of our research as well regarding development of naturally more potent, unnaturally occurring antimicrobials, optimization of that, because really, as many individuals have noted as well, the amount of antimicrobials that are going into factory farming of these animals to, you could say, for growth promotion purposes and sort of to keep them in these really horrific conditions, of course, has a lot of implications on the human health side. And there's papers coming out as well of wildlife species as well having actually antimicrobial residues. So you're really having, because you have to think about whatever goes out of waste is not like the human waste treatment system. Whatever goes out when you're seeing these what they call lagoons with manure, right? You're getting these things going into the environment, but it's not going through waste management the way that it is on, of course, the human side. You can kind of think back historically, like if you look at, sort of stories and accounts for how it was with human waste, and you say, well, it's just sort of floating around in the street. Here you have this from animal production facilities that are going out into the environment. Of course, it has implications, as I said, community health implications for those typically lower socioeconomic in those areas, and then, of course, for wildlife species. And as a global community, how we have what we're relying on. And if you're really thinking about it, it was not the topic of this conversation today. But if you're thinking about how many things within context of modern medicine that relies on antimicrobials, functional antimicrobials, if you try to take that out of the equation, and of course, that's why there's been so many calls for saying this is going to be a disaster and, in many ways, like the end of modern medicine if antimicrobials start working. So let's see what else is in the chat. Let's see, Wendy. So there's a continuing follow-up May-June. And thank you. Appreciate some positive feedback. And also, Deb is mentioning with children and school lunches and patients in hospitals as well. And we can add, prison systems as well, sort of really where everyone is in any kind of institutional settings. And really the notion of not having plant-based by default is really quite horrific. Then Joe is saying the thoughts on the Eat Lancet Commission's proposal, how we change our diets, agriculture, food waste, etc. Seemingly tight margins of staying within planetary boundaries, implementing a just food system. So there's absolutely no doubt that when you are looking at, I think for the community that is here today, how quickly and how sort of stringently would we want these changes to go? And I think there's been critiques in the sense of saying, well, you see some of these reports coming out where they still sort of increase an allowance. Now, there's still, I think, for reports coming out, there's a difference between having still consumption of animals. If you're thinking about factory farming, that is going to be just destructive regardless. It's destructive, it's unethical, regardless of how you look at it. If you're looking, and this was true for even the report back from Goodland and Angham when that first came out, 20 years ago, they specifically said there are indigenous populations who have done sustainable practices for generations. And even if you're looking at a global context of saying how should food systems ideally transition, there would very much still, of course, be room for that. No one is going in and saying sustainable practices that has been able to happen for First Nation communities, that would still be that part of the equation, and they accounted for that as well. Now, critiques for if you're looking at something like for the commissions, where it's saying, well, if you tell people that, well, why don't you just sort of decrease your consumption by this much? What we have seen, because that is what the Good Food Institute is pointing out, even if there's been all these calls to say decrease consumption of animal-derived products, what has happened, despite all of these, despite all the warning calls, despite everything, people still consume these products in very, very large amounts. And this is per capita that just keeps going up and up. And that's why the Good Food Institute, and that's why I refer to this recent book. And I actually was surprised to see with some of these alternative protein technologies, of course, there's still a way to go, but I was actually surprised to see that some of these are actually further ahead than I realized. And what is interesting is when it comes to the cultivated meat, the fermentation, and then, of course, also plant-based meats, when you're combining those, you can make tremendous progress. But as they're pointing out as well, this requires a lot of stakeholders, a lot of collaboration. So I think the thoughts on it is, for sure, this is something that you need to have buy-in from a lot of different areas. And it is for sure concerning that you have had decades worth of reports and IPCC coming out and Lancet Commission reports and a wealth of other plethora of other information coming out, but you're not seeing the changes in behaviors that you would want to see. I think there's definitely many more options. And I think the technology, if you're looking at Beyond Burger, Impossible Burger, but I think what people don't quite realize is how much research and development goes into this for it to actually happen. And you also need to have the buy-in. You need to have government supporting these things. So there's a lot of things that needs to happen. But I want to be, like the closing slide, I want to believe that, you know what, everyone working for the greater good, everyone coming together, and that we can make this happen. And I think, as I said, Bruce Friedrich's recent book, I think is important to read that, to actually have that awareness. And as he said, they are not trying to, you can say, convince vegetarians or vegans, right? Because it's like, well, you're kind of already there. It's like you're just, preaching to the choir. Their conversation is also to say, yeah, we're plant-based, we're vegans, but we need to somehow be able to find ways to communicate and say, how can we utilize these alternatives? And if you go in and you actually look at these technologies and you see what is out there, what is interesting is some of the first, Dr. Uma Valetti, I think, was the cardiologist that actually said, you know what, I'm going to go and actually do a startup. So with the knowledge from human medicine and to establishing what then became Upside Food, to actually say we can take these principles from cell cultures and we can actually apply them to the food system. It still needs to scale. It still needs to reach, again, price parity. It needs to make sense economically. And people need to want to, of course, eat these products. So, yeah, it's a long answer. Thoughts on the idea of cutting back animal products, animal ag versus ending it altogether in the sense of what is most likely to be successful. So I do hope and believe, and when I say end factory farming, that is what I would say that is what needs to happen in the sense of if we're thinking about all the factors and all the implications. Now, that's not, needless to say, something that is going to happen in sort of a short time frame. So, of course, the phasing out And the notion of saying, if you can have these products that then can become that new norm, then the hope would be that if we are looking back, imagining we go however many years from now looking back, the practices of factory farming and the treatment of these animals and the fact that this was even done, it's going to be similarly to a lot of the other atrocities that humans have participated in throughout the history of time. But of course, it's not easy, and it's not something that just sort of happened. It requires a lot of people working together to make those things happen. So the phase out would be, the you can say the most sort of immediate logical thing, because as I've hopefully made a case for here, things needs to change. This is not something that that anyone can realistically, and it seems that the stakeholders that are on the industry side, yeah, of course, they ultimately go where the business case is and where it makes sense. But the point is, you can make up the argument to say, actually, economically, this is sound, because if globally, if everyone is actually not getting their act together, this is going to be incredibly expensive. And then, you take all of the factors into account, the health, the ethics, the economics, all of the above. So let's see. Deb is saying, look at all the money needed to repair damage. Yeah, that's the other point, right? So you're looking at these more extreme weather events because that's exactly what is happening. And now you are also the homeowners are also facing the reality of not being able to get insurance anymore. There are just simply some areas where insurance companies are saying, no, sorry, can't help you. So you're getting environmental destructions, loss of biodiversity. You have individuals for sure, all the costs from wildfires, extreme flooding. You add all those things together, definitely more extreme. You have of course, the melting of areas. You're seeing the glaciers disappearing. There's a lot of things that are just happening in our lifetime. Examples of increases in economic spending due to global warming. So many. I think we already mentioned that, right? So things become, there's a very recent paper out as well from the Nature Publishing Group as well that is actually showing that even if you're looking at the livestock sector and you're looking at the implications of when you're increasing temperatures, you're impacting crops, you're impacting prices. So in the TED talk I mentioned also from Bruce Friedrich, he's mentioning the inefficiencies as well. So if you're looking at how inefficient it actually is to produce live animals and putting crops that you can feed to people, you're impacting the prices of all the things. And if you're looking across the supply chain and you're looking at everything that goes into growing feed for animals, putting it into these animals, and then everything that goes into breeding, rearing, slaughtering, and then the whole food system that goes after that. And that's the carbon footprint. And there's also the land usage, the water usage. So economic spending due to global warming is going to be across all sectors because you increase the temperatures. There are going to be areas where if you're thinking agricultural sector and growing crops, where you just increasingly those are things you can no longer do. Everything becomes more difficult, more expensive. Weather events destroying businesses as well, flooding. We have the fire. So very long list. I hope that sort of summarizes it. Wendy as well is saying, recognizing the bond between mothers, babies, all species, and then referring also as well to the International Calf Cow Mother's Day, and there's a link as well. Thank you for that, checking it out. What is your take on the health of the vegan brand? How various vegan perspectives can work together more effectively? And this is from Zoe and Phoenix. So I think, as we have seen, unfortunately, and the time I spent very recently as well with a group of colleagues in the Nordic countries, also a group of people that were very, very committed to climate solutions. But the reality is that one thing is to talk about what needs to happen in the energy sector and renewable energy, and what needs to happen maybe on, construction and buildings and a lot of things. Once you start talking about food and you start saying, hey, I'm vegan, people very quickly respond to that. And most of the time, unless you're speaking to other vegans, they become, let's just say, either defensive or they become uncomfortable. So I think my perspective is that most of the time I tend to say, I'm plant-based. I'm pretty unapologetic in the sense of, if I'm being asked, and I'm not, I don't shy away from saying I'm vegan. And as I said, I actually think that's important for me, because I feel that there's a whole list of arguments that, with the training that I have engaged in over the years, I feel quite comfortable that I can participate in discussions and conversations across different disciplines. And I do think that you can bring stakeholders together to have these conversations, to say, you know what, do you care about human health? Do you care about non-human animals? Do you care about the environment? Do you care about just future generations? Do you have loved ones? Do you care about how their future is going to be? Do you care about the ethics of it? Do you care about historically what humans have done, and moving forward, what side of history do you want to be on? Do you care about the business case? Do you care about the economics? And so on and so on. So I do think that in general, you have people that they tend to sort of shut down very quickly if you say the word vegan. So as much as we can have conversations that perhaps are increasingly saying, well, as long as it's alternative proteins that doesn't involve live animals and factory farming, and that you can do something that is moving towards this is going to be ethical, sustainable, I think that's the way to go. It's not a super clear answer, but that's sort of my take on it. Dr. Melgarejo, is that a Komodo dragon in your backdrop picture? Question mark from Deb.
I answer yes, and it's part of our clinical research in search of novel antibiotics. We have been successful. We have identified several molecules. We have patented the molecules, and we are looking for alternatives, because in the next decade, the antimicrobial resistant crisis is going to be bigger and bigger, and it's quite concerning. We have documented dogs and cats having multiple antimicrobial resistant genes, and they have not actually been exposed to those antibiotics. So those antibiotics are coming from the other sources, most likely dietary, water, or horizontal transmission with other species. So we are looking into that, and that's another area of what Dr. Linde and I have done. One thing that is relevant for this particular talk or symposium is that we have been privileged to visit many parts of the world, and we have seen how our ocean is dying. We have been scuba diving in different places and in beautiful, amazing, rich oceans. We have visited in 5 years, 10 years, 20 years later, and the diversity and the colors are almost gone. And people say, no, it's beautiful and you need to go, and we go there. And it's really sad that people don't understand that what you put on your dish, on your plate, is actually affecting the world. And we try to be outspoken, and you become unapologetic, as Annika said, because I'm just sad to see how people react, and they laugh, but you cannot do anything other than presenting the evidence and educating people. Even within my own family, I have to just define clear limits about who I am and why I am like that. Being mostly raised Mexican, it's a very carnivore society, but it's I am a scientist, and if the science is telling me this is the data, I would be a hypocrite continue drinking milk or eating meat and ignoring all the pain and suffering. And on top of that, there's hundreds of pieces of peer-reviewed literature saying it is wrong. It's something that is affecting your health. So I have in the last comment that I can say is that through helping my patients, particularly dogs, that I have asked the client, okay, we're going to start with a plant-based diet. We're going to do this. Some people don't have a plant-based diet, commercial available food in other countries. So they have actually made a homemade diet. I have sent or shipped the supplements from a very reputable company here in the States. And what they have seen in the dog, it has been shocking. And the company, I have a particular case in Mexico that this particular dog had inflammatory bowel disease. He was diagnosed with intestinal lymphoma, and they were going to euthanize the dog. And I said, let's just try this. And the dog responded very, very well, started stopping the diarrhea, started putting weight. And after a year, the dog was living a happy life. And the family told me, can we eat the vegan diet? Because they had the money to actually hire a chef to prepare the food for the dog. And then they saw that on the dog, and they were saying, is that safe to eat Paco's food? And I said, it's not only safe, it's your moral responsibility, and it's good for you. And the whole family went vegan, and now they're very, very happy. So if I can change a family at a time, a student at a time, I can go and sleep peacefully at night.
I have a question for the two of you. 'Cause clearly, you have a much broader perspective of the health of the world as a whole, as well as people, as well as animals. What led you to decide to work in the veterinary part of it? Because there obviously are so many aspects to this.
So I'll tell you that. So I'm a first generation going to university. So I mentioned very briefly. So my father died when I was a small kid, and then my mother died not that many years later. And I came from a background where there wasn't like higher education was not really sort of part of the expectation. So, but I always had this idea that I knew I loved animals. I wanted to go into veterinary medicine, and I just sort of hyper focused on that educational path. And then I think you don't realize what you go into when you enter veterinary medicine, because a lot of people, I think, they enter veterinary medicine and they assume, oh, everyone must love animals, and that's why they go into that field. And of course, there's truth to that, but also I think what you are naive about is all the violence that is also part of veterinary medicine. And we have had conversations with colleagues from different health professions, because a lot of veterinarians shy away from talking about what goes on in production animal industry, what goes on inside factory farms, what are considered industry norms. Have you seen slaughterhouses on the inside? Do you know what goes on? Do you actually see these animals in these hyper confined conditions? And you also have that cognitive dissonance. Even when you are in veterinary medicine, and we have seen a lot of things, and of course we have been part of the veterinary medical world, but I think as the years sort of went by, I think I increasingly thought that working at the intersection between different health related professions made more sense, to me at least. Dr. McGillivray will tell you his story, but for me, I realized if I want to try and do something that I somehow can see can translate into helping the greater good, I need to also understand like the you can say the language of the human health side better, because you do work in silos, and human health works in its own silo, veterinary medicine work in its own silo, and we really need to come together and having these crosstalks. And veterinary medicine professionals, veterinarians, you would hope would be more open to say, you know what, these things that are going on, both with production animals, laboratory animals, all of those things, that's why we have, 10 plus years of collaborating, supporting also the Physicians Committee for Responsible Medicine, because I think they're quite unique in the sense of really having a very multi-pronged approach, and as a very, more recent time, also thinking the planetary health. So that was sort of what I went through the formal research training, also did a PhD, and I saw a lot of things over the years working at different universities, and more recently also understanding, you also have to understand, what actually goes into impacting sort of the finance and economic side of it. So yeah, attracting me to veterinary medicine was sort of, you can say, partially the naive way I think that most go into veterinary medicine, not realizing what it actually also entails. Let's hear what Dr. Migrejo has to say.
Since I was a young kid, I don't remember exactly when, but my mom told me that I had a very unique love for animals. And I was privileged because my father was an archaeologist and he was always working in Southeast Mexico, Central America, and the north part of Latin America. And I was able to interact with animals in the tropical forest. So I was firsthand looking at alligators and monkeys and deers and armadillos and all these things. And they were pretty much my friends. They were not my pets, they were my friends. So I had a very unique contact with that. And I grew saying, I need to do something good for them. So when it was out of this powerful connection and energy. And when I interview students that they want to be in a vet school, what do you want to come? I said, well, I love animals. I said, well, then just get a portable stool, sit and look at the animals at the zoo. What do you want to do with that love? Or what? I mean, you love animals, but exactly what? It has to be an objective. It has to be a productive love. And that's what I was able to transform. And I'll share a picture. Dr. Linde and I travel around the world, and when we were in Africa, I fell in love. It was originally a research, but I fell in love with African spotted hyenas, and I decided I need to bring these animals to the States because these are going to be my control animals. And everyone was laughing at me. Remember, I told you when people don't agree with me, I know that I'm right. So people say you're crazy, don't work with that. And we were able to find actually a very powerful antibiotic with them. And just doing this, even at my adulthood, it's just incredible when I am able to work, but I'm able to, being a kid, to still love the animals, and we interact with that. And Dr. Linde has been in South Africa doing echocardiographies in white lions, and you see the pictures with white lions just climbing into the face. I think it has to be for me, it was a love, but it was a love that needed to translate into something. And every day of my life, I look and I get up and I said, okay, what am I going to do that is going to make a change and improve the well-being of animals? And if possible, in humans, that we are also animals, but my priority are the animals. So for that, I completely agree with Dr. Linde. I don't have to apologize for being vegan. I don't have to apologize for doing this. If you have an issue, well, then it's your issue. I just in the conferences that I'm invited because I speak Spanish, I am very direct, and I have had multiple people, students say, thank you so much for saying that. Thank you so much for talking about the vegan diets. Because they asked me, Dr. McGregor, are you vegan? Trying to see, what is he going to say being a vet? I said, of course I'm vegan. Look at me, I'm 65. If you don't want to look in a bad shape, you need to think about what you eat and your lifestyle and everything. I said, but it's not only that. And I talked to them and I said, all of you guys, usually they are medical students or veterinary students. I said, you love animals. Raise your hand if you don't love animals. And no one raised their hands. I said, okay, let me tell you one thing. You love dogs and cats. Because if you love animals, you would not eat animals. You would not torture the animals. And I said, this is called cognitive dissonance. You love your pet. you have your beautiful cats, but you're eating a steak and you're eating a pork chop from a poor sow that was 3 months in a little cage having the piglets and torturing, and that is okay. That because it's just this situation. So I said, don't be hypocrites. If you love animals, stop eating animals. When have you heard that a pediatrician say, "Oh, that baby looks very tasty"? It's like it's the same situation for me. I look at the dog, I look at the animals. I just don't want to eat them. I took an oath to say I will protect and I will do my very best to use my knowledge to improve the well-being and to avoid pain and suffering. If I'm a real vet, I cannot promote this. And let me tell you, a lot of times students come and some of them they hug me, some of them thank you very much. I feel isolated. Having a person so important because they think I'm important because I'm a speaker, saying that opens new doors and everything, but it has had also consequences. When I was in South America, I was speaking and I was talking about the casing and how bad is the meal for human health and everything. And they needed to escort me at the middle of the conferences because the association, the dairy association people were there and said, "I'm sorry, Dr. Megako, we need to stop you and we need to take you to the airport," because people were really upset. And I said, well, at least I would die doing something that I love. And I'm still alive. But anyway, that's my part.
Thank you for that. It reminds me of Dr. Richard Pitcairn, who lives here in Sedona, and his comment when other vets ask him why he's vegan is, "I don't eat my patients."
Yep.
And,
I have that quote in my presentations, and that's his words, and I love that. As a good vet, you don't need your patients.
Yeah. Well, we need to wrap up. This is, I love what Wendy said. This has been an incredible program. So pleased to get to know these amazing speakers changing the world for the better. And we couldn't agree more. We had 115 people sign up for this. That means that some of those who aren't here are going to watch the recordings. And as we said, we're going to make these recordings available broadly, and we encourage you all to then share them with others, because those of you who were here and were able to hear these amazing presentations know the value of that and the importance. So please, please, please share them. These are not going to be privately held. They're going to be broadly shared. And we just salute the dedication of all of our presenters, and want to remind you too to watch for your companion guide that will have more information. Go ahead, Don.
Yeah, well, and I was just thinking the corollary to human health is quite real, and Dr. Mejio relate to that. But here's a brand new book that just came out by one of all of our heroes.
Oh, yeah, Dr. Clapper. I admire Dr. Clapper, Michael Clapper.
Moving Medicine Forward, and it just came out, and we're a quarter of the way through the book right now, but it's fabulous. But the relationship for all living beings is so very real, and we just think that we appreciate so much the dedication of the two of you and the other two presenters as well. And as Bev said, we're going to put everything out there about this conference, including the videos and all of the other information on pawsandplants.org, the website, by the end of next week. And then you'll be able to share the videos from all 5 segments of the summit. And because one of the segments was the rotation of all those wonderful pets that went through there, and you've got to share that as well with your family, friends, colleagues, and even other veterinarians, because you two folks get it. But
thank you so much for the invitation. It was wonderful, and I know each of you, you are heroes in your own environment, in your own community, doing the best for the planet. So I feel privileged to be able to talk, but I know that you're doing your part and more. Dr. Almighty May, she's a veterinarian, and she went to Davis many years ago, and being vegan and vet, it was horrible. It was just like, and I have heard colleagues that said, no, she's vegan. It's almost like don't listen to that vet. And she is a pioneer, and she keeps pushing and pushing, and her demeanor, she's never going to get tired. So I know each of us do a very good time. So we have plenty of admiration for our professionals from our colleagues, and thank you for the invitation. Every opportunity we have, we will be there because we need to keep spreading the knowledge that we are able to generate and the message.
Absolutely. And
Dr. Linde.
I put a hand up because I know I already said a lot, but I just wanted to, it was exactly, and it's a good segue because my hand up was exactly to say that we have Dr. Mighty May with us on the call today as well. And
yes.
Much gratitude to Dr. May. So Dr. May was part of the group that when Dr. Melgarejo and I moved to Western U, and really a group of both on veterinary medical, legal, a lot of professionals coming together, doing crowdfunding, doing fundraisers to actually make the study a reality. So we're very, very grateful, Dr. May and collaborators, everyone that made that happen. And Dr. Melgarejo mentioned earlier on that unlike funding coming from the big companies, of course, we're doing this in very different ways, and kind of we need to think about, how do you fund this type of research? So thank you for everything you're doing, Dr. May, as well. I don't know if you want to add a few words maybe before we close up.
Thank you. Yeah, I'd love to continue sharing the work you've broadcast today, and I look forward to giving more presentations about this in the future. So it's really important work. So keep it up.
Thank you so much.
And I just want to say, everybody on this call who has stayed through this presentation is on this team of heroes who are trying to make a difference in the world and making a difference in the world. So whatever sector you're working in, it's part of a much broader team. And we're just grateful for all of that. And I liked Deb's comment that she loved the pet parade and the music. I have to give a little disclaimer here. You will see a recording of the pet parade. The music will change because we were using licensed music, and YouTube's not going to let us put that music out there. So there will be music, but don't sell it on the fact that the Beatles are in there, because they won't be.
Okay.
But it's just really, it's great just how many people just have come together to make these happen, this study happen, to make these events for you today as well, for putting all of this together. And it's really it's a team effort, and it's, across, as you're saying, Beth, it's across disciplines, and really trying to have as much conversation as we can. And, in sort of these framework, you can say, it's easy in the sense of we know the area, we learn something every time, but the difficult conversations is, as we also talked about, you go out and have conversations with people who disagree, and hopefully little by little we can have enough conversations to say, well, we should do something that makes sense for everyone, not just humans, the planet, everyone. So
and we need to thank our European colleagues, Andrew and Ariel. I saw them speaking in Amsterdam. We actually shared the same podium, and I told Don and Beb when they contacted us, "Are you interested in doing that?" And I said yes, but please invite Andrew and Ariel because they have a message, and each of them it's a different message. But putting it all together is like a puzzle. It makes a lot of sense. They are humble. They put money out of their pockets. They're always, pushing and pushing. Andrew is a machine. He's a super smart guy. He doesn't sleep. I think he's probably half Martian and half human because he works so hard. We have the conference, and it was close to 11 p.m. And he said, "Do you want to have a cup of coffee?" I said, "No, I don't drink coffee." Like, okay. And then we were talking, and it was 11 p.m. and Andrew was just drinking coffee. He said, "I just need to catch up with some emails, but let me just show you this." And I was like, okay, humanly, I am at my limit. But Andrew kept going and going. So I'm so glad that he was able to be here, and Ariel too. So thank you.
Well,
yeah,
To you to connecting us with them.
Go ahead.
And it's so important to sort of also see what is going on. You know, you're working across different continents and you're seeing what is going on. And of course, you can see that sort of the push also to shift things and shift food systems, and sort of how willing or unwilling are people to change certain things. It's just really, really important to keep those collaborations. And you know, as we've said before, but I think it just serves, you know, repeating as well, is just for everyone who contributed just to the crowdfunding. There's so many individuals out there who just, you know, contributed in ways to make this happen. And as, you know, as we said, you put in an acknowledgement slide, but there's so many people to make these things happen. So thank you to everyone.
Yes. All right, we're going to close out, but you have fed our souls today and given us energy to keep going. So thank you so much.
Thank you all.
Thank you.
We'll see you again.
See you next time.